Good morning. This is blessings of peace be upon you all. Greetings and blessings to all. Glad that you can join us today here on another program for ShuraTV and our health program. Today's August 31st, 2021. We're in the swing of things. Schools have begun. Health wise, there's still a COVID pandemic going on with the Delta variant. And to add insult to injury, we've had now in the US a major hurricane system by the name of Ida, who is going through, and the end of it is going through Louisiana and eastern Texas area and going north into the southern states. So, what we have on our hands there is a major disaster. And of course, today we wanted to discuss a little bit about disasters and their effects on our health. And this is something which is important because time to time, living in the US, we do get different types of disasters that occur. And disaster health is a topic of its own, and it has a protocol and a study in disaster health management and mitigating the risks of disaster health and what the consequences are for populations. So we wanted to discuss that a little bit. There's many types of different disasters that'll come about, and we'll get into that in a second. In terms of schooling and COVID, a lot of schools have mandated the masks in school to prevent young ones 12 and under from getting the COVID virus. So that's very important that you protect yourself and your loved ones. And we as adults around our young children, when we're going out and about, we should definitely mask up. And if we haven't yet, we should definitely try to get the vaccine as soon as possible so we can decrease the transmission and the existence of COVID in the society in general. So if you guys can please oblige with that and talk to your personal physician about that, that's a humble request that I'm making of you to decrease the effect and the widespread, the further spreading of COVID. Definitely get a vaccine and definitely mask up in places that you're in indoors with people that you don't know. So it's very important to do that. Getting on to our topic, as you guys have heard in the news, we've had a huge um, storm, a huge Hurricane Ida, and it was worse than the previous hurricane that happened 16 years ago. So it's hit the state of Louisiana, New Orleans, all those Lafayette, Shreveport, all those cities that are going up and down that street. And what we want to know is, what do we do as number one, as citizens living in the U.S. to help them, and then number two, what are some considerations to have for the health effects of such disasters? Um, Health disasters are typically of three types. They're categorized into three, meaning that they're man-made, they're natural occurrences like the hurricanes, and then there's a hybrid of both. So, as an example of a man-made one would be a natural disaster or a humanitarian crisis that is that comes about on populations due to political choices or politics or something, or war, which is all in the hands of people. These things that come up, we have to make sure that the health effects on that population is mitigated and decreased risk is on them. So, for example, the withdrawal from the Kabul airport and in Afghanistan, Biden's choice of withdrawing so quickly, it can be considered a health disaster for that region and for the Afghans. So this is a man-made health disaster. The hurricane, on the other hand, is a naturally occurring one that has hit Louisiana and those southern states. So these are things to consider. And then the hybrids are, a mixture of both. It could be man-made and as well as naturally occurring. Sometimes they're synergistic, where we do things, for example, the plastic bottles, the plastic waste that are put into the ocean. this is number one. This is man-made, and then the consequences of naturally occurring or decreasing the the effects from the regular biological and environmental cycle of rain and heat. It affects all that. So because of that, it could be a hybrid. So focusing a little bit on the needs of people in Louisiana currently. Of course, there was floodwaters that they said that it reached people inside their houses up to their necks and chests. So this is really, really concerning, and they've labeled it a national emergency, and all personnel, whether it's the guard and the army, they've all kind of focused on helping these people because they're at their most vulnerable state. Currently, the National Guard was deployed. The U.S. Army is helping out as well because the whole city's been devastated. From the health perspective, number one, we look at the food security. Number one thing, are people getting enough food? Do they have enough food? Do they have enough rations? Do they have enough shelters to go to? Because number one thing is, if they can't get to food, people get stranded in their house, especially if they haven't listened to the evacuation warnings beforehand. It's very important to heed those warnings from the federal agencies when they tell you that, hey, you got to make sure that you clear out by this day or this evening, so that you don't get stranded. And now there are people stranded, and there are rescue missions that are going on. But from the health perspective, what we do is we try to look at their food security to make sure they're food secure. Number two, infectious disease is very important. Infectious disease is something that happens specifically in places where there's lots of moisture and storms and things like this. We get a lot of people that come up with a lot of different pathologies, and those things need to be assessed. Specifically because now the weather there, it's a little warmer, it's a little humid, and now you have moisture not only in the household, but up against people. People are really not staying dry. They're trying to keep dry. So that's very important to keep that in mind. And these type of health disasters are a direct result of these types of emergencies that happen, like like Hurricane Ida. So what we want to prevent is death. You want to prevent all these injuries that happen, and then there might be disabilities that happen, and then of course there's the psychosocial effect of these natural health disasters that come about from these natural catastrophic events that happen, like hurricanes, tornadoes, earthquakes. So these are things that we need to focus on, and there's many teams that mobilize from different areas of the world, and they go to that area, or in the US from the different cities. They have mobilization teams, whether they're with paramedics and doctors and these people. They all get together and they go and try to alleviate these issues. Looking back at a man-made disaster, the health consequences, for example, of the Kabul airport in Afghanistan, there was tons of people together, held up in an area, and for 17 to 28 to 30 hours on end, these people were in lines in crowded areas. And specifically in this condition now, we're in a COVID pandemic. So COVID, with these things, of course, the restrictions weren't met because these people were crowded in these areas. So we have to make sure that when those people get to where they're getting, they have to be quarantined. They have to be kind of a health assessment needs to be made. They need to be taken care of from the medical perspective. The health perspective needs to be looked upon because it's number one. If you don't have your health, then you can't further, get transported to other places. It's very important to get that done. And for those populations that are being transported or evacuated so quickly from crowd, I think in a span of 10 days, they evacuated more than 120,000 people from one airport. There was all those C-17 aircrafts going, and the conditions that people were in were very, very concerning from a health standpoint. So when they get to the country that they were getting to, then they get an assessment, a complete health assessment. Hopefully, they're getting a mental assessment as well to see, to cope with that trauma, and then also if there's a need for any type of vaccine, if there's any kind of symptoms they have, coughing, fever, headache, runny nose, anything related to the current situation of any type indicating an infection, then that needs to be tended to as well. So these things come up with all these disaster health situations because there's a huge number of people. They're concentrated in an area, and that type of thing needs to be sort of thought out and planned by these organizations like the World Health Organization, the UN, the U.S. Aid, which is another humanitarian organization. These organizations, and now currently the Department of Homeland Security is working on that resettlement issue as well. And the health aspect of it is very important. It's very important because not only does it endanger the people themselves, but also endangers other people that they come into contact with. So these considerations need to be taken. There are many, getting to Louisiana again, the hurricane, it has many different effects. Infection, a lot of these infectious diseases that come up from waterborne diseases. It's very important to rule those out. And then these people get transported to shelters and shelter areas where there's, again, big stadiums, big areas or hangars where they're getting put in together with multiple other people. So these situations themselves, it's sort of like an incubation area where these people become exposed to multiple bacteria and viruses because just the number of people, the sheer number of people that have increased in those areas. So these are considerations to take from a health perspective to make sure that everybody is in a clean, sanitary shelter. And for that to happen, everyone needs to get assessed. Everyone needs to, for example, a lot of people, when they get transported into these facilities, their regular medications that they're taking, some people forget because the evacuation was so emergent so quickly that they don't have all the things that they had when they were sitting at home and they were relaxed and they were taking their daily medications. So from that, then you get other clinical issues that come up from people not following their regular routine and regimen, the regular medication that they've been taking normally. So these things need to be thought about, and disaster medicine is an aspect of health which has its own protocols and processes and mitigating factors that we need to look upon and review and try to try to keep in mind when these things happen. What we can do as people here living and watching or observing what's going on is to try to help in the process. So there are many different organizations that are helping, whether it's these refugees coming to the U.S. or whether it's these U.S. citizens and the U.S. population suffering in Louisiana. There are organizations like the Red Cross, like Catholic Charities, like Islamic Relief. These organizations have plans for these situations, and they've thought through all the processes, and they've done it multiple times. So they've been through multiple disaster relief efforts, and they've focused specifically on different health issues as well that come about from these disasters that happen. So I would urge you to find out about these efforts and then contribute if you can. If you're available to contribute, that'd be awesome. In the case of the Afghans coming to the U.S., if you're Afghan or you know the languages, you can go translate for them. You can volunteer. You can reach out to some of these resettlement refugee programs to help them. That would be the best thing you can do. Or you can donate to these programs and help them with the new equipment or materials they may need to start their lives here in the U.S. And a lot of people are doing that. A lot of people are helping with that. And same thing with the people in Louisiana that have just been flooded. Their whole house, their whole living system has been uprooted. So these people now need basic necessities of life. Not only just the regular daily food items, but just basic things that hygiene items, normal things. And you can donate that. You can donate care packages. You can donate cash towards it. These things are very important to keep into consideration. Um, you know, so these are the health concerns that we have with disaster health. Um, there's a whole course of things where there's guidance and indications on disaster health risk mitigation, which means that there's a whole host of variables that we have to look at, and we have to keep in mind what they are in terms of the food security, shelter, general security in these environments where there's usually not enough law enforcement. So there's crimes that happen as well. There's increased crime in these type of disaster health situations. So people need to be aware and cognizant of these things that can possibly happen. Furthermore, you can always, reach out to your local city authorities or your county or your state, and then federal as well. So there's always, in the U.S. FEMA, Federal Emergency Management Association. They're the ones that take care of the federal response to emergencies. But you have California, you have the California state that does it as well, and that's important to keep in mind. And you should, as a precaution, have these numbers on hand. God forbid something happens, there's an earthquake, a tornado, a storm, or some type of man-made disaster situation. It's very important for you to know exactly where to turn to and have a plan. Proper prior planning is very important in these situations. um, to mitigate the risks, planning is the number one thing that you can do, and the planning should be done before you're in the disaster. Unfortunately, sometimes we see that there's concurrent planning going on because things change, things are dynamic. But for at least the naturally occurring disasters, whether they're earthquakes, tornadoes, hurricanes, these kind of things, we can plan ahead as a community and be ready for these things if they're likely to occur in your local settings and local community. That's very important to plan. Without planning, you don't want to be taken by surprise with all these things that could happen. So those are the things that we wanted to kind of bring about and bring to light, so that you start thinking about that in terms of um, planning for it and being ready for some type of uh, a disaster or a health disaster that happens. You should have contingency plans. This is very important. And if you plan about it, then decreases the anxiety, decreases the stress, and you'll know what to do. For example, those living in Southern California should have an earthquake preparedness. And in that case, you should have, a set of your important papers, your important health documents, your medications that you might be taking, or your loved ones, your children or your elders might be taking. It's important to have that on hand and have a little uh, um, a bag or a briefcase that has everything ready to go. Well, you can just grab it and leave the house. You should have something like that. And then, of course, there's food and electric considerations as well. That you should know how to turn off your electricity, how to turn off your water in your house. These things are all things that can mitigate the health risks to you and to your family. It's very important to do that. Um, we wanted to discuss some of this stuff. If you have any questions or concerns, or if you'd like to help with Louisiana or with the Afghan refugees coming back into the U.S., and you wanted to get involved and help them, we can you can comment on this video, and we can give you resources where you can go ahead and help with these disaster relief efforts. With that, I'd like to thank you for listening. Hope this was beneficial to you, and hope this can kind of create a initiative in your mind to look into these things and prepare yourself and your family for the unlikely event of a disaster or an emergency, and prepare for it and plan for it. That's the best thing you can do. No reason to stress. It's always good to plan and prepare. And once you do that, then you'll be ready for anything that comes your way. With that, I'd like to wish you a wonderful day. Thank you for listening, and we'll see you next week.